My name's Nicole Langelier. I'm an oculoplastic surgeon at Virginia Eye Institute, and we're excited to talk about our new aesthetic center at Virginia Eye Institute Short Pump. What's particularly exciting about this is that it's one location for all of our services. Not everybody needs or wants surgery, and there's a lot of options out there. And so having had the experience in the surgical training to know what the most involved options are, we can sometimes dial it back and say, you don't necessarily need surgery, or that may not be what you want. Sometimes we have little areas that start to hollow, or we have some wrinkles that happen from musculature movement in the face. Those things can be targeted with filler and Botox, and we can really customize what each individual patient needs. One thing I'm really proud of is that it's our surgeons who do the injections. So it's always Dr. Bearden or myself who does the Botox injections or the filler injections. And I think that's important because it's a really delicate area of the body around the eyes. And you need to know the anatomy very, very well to be able to do it well and to do it safely. And so I take a lot of pride in that. Our new devices that we have at the Aesthetic Center include IPL, or intense pulse light, that helps with some of the redness of the skin, some pigmentation, and we also offer radio frequency treatment for skin tightening. But then we have what's called fractional or microneedling radio frequency, where we actually use itty-bitty baby needles to deliver radio frequency energy deeper in the skin and use some heat to create some tightening. And so that's not as involved as surgery by any means, but a more involved procedure that we actually do with our nurse practitioners, and they're excellent. And one thing that I think is great about working with them is that they have a tremendous amount of medical experience, not just in working with the skin, but really in taking care of major health issues. And so they have the background and the intellect to really recognize if somebody has a contraindication to some of these treatments. And it's just something I'm really excited and proud about. As a doctor first, then I became an eye doctor, an oculoplastic specialist, and I take care of people who have tumors and even some life-threatening conditions having to do with the eyes. And it's really fun when you can make people feel like they look better too. But first and foremost is the safety, and I'm really passionate about that. I try to be really careful, and so I think that's hopefully reflected in our new center and our practice, where you could talk to us about anything from surgery to injectables done by the surgeons to some energy-based devices done by our excellent nurse practitioners.